Hello class, welcome to another pre-recorded lecture. We'll be talking or discussing today definition and importance of spiritual assessment. Definition and importance of spiritual assessment. So today we'll be talking about, the what and why of spiritual assessment. We'll be talking about the what and why of spiritual assessment. And so to get us started, we'll be having a definition of what is spiritual assessment. When you think about spiritual assessment, what comes to mind? Spiritual assessment, according to Hodge, can be thought of as the process of gathering, analyzing, and synthesizing spiritual and religious information into a specific framework that provides the basis for and gives direction to subsequent practice decisions. So again, as you can see, spiritual assessment is where you gather information, you analyze the information gathered, and you synthesize that as it relates to the person's spiritual and religious background, and also that information that you have gathered, analyzed, and synthesized will give direction to the care plan. And so again, spiritual assessment is about the exploration of both the spiritual and religious dimensions. The initial assessment of a patient's spiritual needs often can pose a challenge, but it's very important that we go and gather that information so that we can analyze in the visit, and then we can synthesize and see how best we can support that patient. And why is spiritual assessment important? Why is it important? Why do we need to do a spiritual assessment? Some patients and families identify that religious and spiritual beliefs support and sustain meaning, and that health provider inclusion of spirituality enhances their care. So here, patients are saying, and they have identified that religious and their religious and spiritual beliefs are important. And if their religious and spiritual beliefs are important, then as chaplains, it must be important to us. And they are saying not only that they are important, but they are a means of support that sustained, meaning, and also help with enhancing their care. And if that's important, we also, as chaplains, we want to make sure that we do a good job in assessing their spiritual needs so that we can be able to provide the appropriate spiritual care. 94% of hospitalized patients believe spiritual health is as important as physical health, and that 40% of patients use faith to cope with illness, and that 25% of patients use prayer for healing each year. So again, 94% of those who are hospitalized, they're saying that spiritual health is an important part of health. And what's interesting is that we know that what might be going on physically, or can be exacerbated by spiritual distress, or what is going on spiritually, because we're integrated human beings. We're not segmented, and so we're integrated. We're whole, mind, body, and spirit. So whatever influence the spirit or affects the spirit will also affect the body and will also affect the mind. And so again, going back to this, again, 94% of hospitalized patients, they say that spiritual health is important. And if it's important to them, then we want to be able to assess, to be able to provide appropriate resources. Also, 40% of patients, they use faith to cope with illness. And if they use faith to cope with illness, we want to assess that and see how are they using their faith to cope, and how can we be there to help them to leverage their spiritual resources to be able to better able to cope with what's going on medically. Also, as we see that 25% of patients use prayer for healing each year, 25%, that is one in every 4 patients. And so if they use that, we also want to make sure that we're assessing that, accessing that, and providing that to a patient so that they can feel whole and they can feel like their spiritual resources are activated and helping them to support. So we want to be able to do that. The World Health Organization acknowledges that holistic care that integrates the role of faith, existential question, and a meaning in care benefits patients and their families. So again, the World Health Organization, as reported by Robert and colleagues. And so if that's important, because again, the role of faith and existential questioning and meaning, they benefit patients and families. And so if they benefit patients and families, and we want to assess that and making sure that we're asking about their faith and how they're using their faith to help them cope, asking about existential question, asking about where they find meaning when they go through tough times, what means of strength they would normally rely on. Studies have reportedly found that most practitioners affirm the importance of spiritual assessment. So even the practitioners are saying spiritual assessment is important, but even if they were not saying that, we as spiritual providers, we know that spiritual assessment and spiritual care is important, because again, we are holistic being, mind, body, and spirit, and whatever affects one aspect of our being affects the others. What's the purpose of spiritual assessment? Why do we do what we do? Why is there a need for spiritual assessment? So we talk about the importance because it's important, and we can see that it has lots and lots of benefit to our patients. And so the why. And so one of the things is that spiritual assessment elicits patients' thoughts on this topic. So in other words, when you do a spiritual assessment, then you get the patient to participate, and you get to hear what they think, and get to explore with them about their resources and so forth. So it elicits patients' thoughts on this topic, because we want to hear what they think. We want to support them in the way that they want to be supported. And so again, doing the spiritual assessment will help us to be able to understand the why. Next, it allows patients to identify spiritual beliefs and practices and resources. So not only that, the spiritual assessment, gets the patient's thoughts on it, but also it also helps the patient to identify their spiritual beliefs and the practices that are meaningful to them, and also the resources that they would like us as chaplains to provide to them so that they can support. The spiritual assessment also allows patients to be able to identify practices and resources that may positively impact their health. They know themselves longer than we can, longer than we know them. And so we want to be able to understand that the patient is the expert and what's going on with him or her in that sense, and what, would be beneficial and what might not be. And so in that sense, we want them to guide us as we provide appropriate spiritual support and care. Next, it helps identify sources of distress. So doing a spiritual assessment helps the chaplain to identify the sources of distress as it relates to stress, anxiety, and that the person is just burnt out, and that there are financial pressure, relationship conflicts, there are concerns about many things in life. And so being able to identify that source of distress will allow the chaplain to tailor those interventions to making sure that those interventions are tailored to identify, the sources are those triggers of specific distress. Helps identify the needs of care recipients. So not only that, the source of distress, but what are the things that are needed so that this patient can feel, supported, so that this patient can access, those resources, and so that this patient can cope better with what's going on medically. And so as chaplains, we want to be able to do that. If it's in the case of anxiety, then we also want to make sure that we provide interventions that are, that are helpful in terms of anxiety, reduction. That could be, scriptural mindfulness, that could be meditation, that could be, deep breathing. Like, for example, you could tell the patient that, you're going to breathe in, you're going to inhale for 3 to 4 seconds, and you're going to hold that. And then, when you exhale, so for example, when you inhale, you say peace. And when you exhale, you say tension. And you keep doing that, because what happens is that deep breathing is going to oxygenate the blood. And once the blood is oxygenated, it's going to allow us to be clearer, and it's going to deactivate, in a sense, reduce the impact that the amygdala and the temporal lobe has on the body as it relates to anxiety. And so again, doing a spiritual assessment helps identify the needs of key recipients. If it's a case where the patient is anxious about a procedure, then as chaplains, then you can talk to the patient and find out what specifically is the patient anxious about, and being able to probably talk with a provider and see if the provider can provide more clarity, as opposed to provide clarity on the procedure and what is expected, and can provide information to the patient as it relates to the time that this procedure will take, and what's the success rate, and so forth, so that he or she will be able to cope better. Again, assessment is important, because 94% of patients are saying spirituality and their religious beliefs are important to them, and it helped them to cope. And if it helped them to cope, then we also want to be able to help them to access those resources, that they can leverage those resources, that they can that these resources can help to benefit their health care. And so I hope that this lecture today was beneficial, and that it got you thinking about spiritual assessment and why it's important, and why we need to do what we do. And so again, thanks for joining today.